We know that sometimes there's a lot of focus on the media about that this is maybe a made up condition just to sell things. And is there over treatment of this? How do you respond to that?
So what I would say is ADHD is a global health condition. So I've been a part of initiatives with the World Health Organization talking about the importance of ADHD. This year at the World Federation for ADHD was held in Prague. We had a number of people come from underserved developing nations saying ADHD isn't in just developing countries like the United States or Canada or Great Britain, but imagine being somebody from sub-Saharan Africa or South America where you have learning challenges and you're having a hard time keeping up. So we know that ADHD presents all around the world, and we know the prevalence tends to be fairly consistent across developed nations all around the world.
So what do we say about this over treatment? Is there such? I mean, is there a time when it can be misused? Can the medications for ADHD be misused? And how do we deal with that?
It's yes and yes. Can ADHD be overdiagnosed? Of course. Can medicine sometimes wind up in places where they shouldn't wind up? Of course. A dorm room, a fraternity, given to a friend or a neighbor. Of course that can happen. But the biggest issue is the people struggling with ADHD who aren't getting treatment, Jared.
And how is this for you as a clinician who treats ADHD? But even for my patients, I've had difficulty getting access to medications for them, especially the past couple of years, correct?
Correct. So I'll give you a couple of pieces of data. So last year, the CDC did something they hadn't done in 20 years. The CDC every month studies an illness of the month across the country. How common is it? How prevalent is it? How much does it impact people? So it could be cancer, diabetes, obesity, cardiac disease. Last year, adult ADHD was their health condition. We had new updates from the CDC last year on something we'd never had in the past 20 years. How common is adult ADHD? 8.5% of the population. So right at 8% of the population, Jared. How common is it in men and women? Almost 1-to-1, very similar male to female. And then here's an important fact. When does the average adult first get their diagnosis? For women, 2/3 get missed in childhood and don't get picked up until adulthood. Going to something which is what primed me on this is because I wrote an article for Journal of Clinical Psychiatry that the CDS asked me to write to talk about their data. There's one of the questions they asked is, how many adults out there had a gap in their treatment in the past year because they couldn't find their medicine? It was 45%. 45% couldn't find their medicine. They had to drive all over to find it. And one of the things we found, Jerry, and you've probably dealt with this in your practice, if you're driving to a pharmacy in a different city and you show up asking for an ADHD medicine, all of a sudden the pharmacy acts like you're doing something nefarious, when instead you're just desperate to find your kid's medicine or your medicine because you've gone a month already and you haven't had it.
So what limitations and why do these limitations exist?
I think this is the good news, bad news. ADHD medicines are highly effective, but there's concern by everybody in the healthcare ecosystem that we don't want to make sure they're being misused. Misused in ways they shouldn't, misused by somebody who shouldn't be getting the medicine, misused more commonly than they should be getting used. So I think that's where technology can be our friend, where we can monitor medicines, make sure they're being used in the way they should, make sure people are consistent with their treatment, but they're not over or undertaking their treatment. I think that helps to allay some of the fears of people like the DEA or the FDA or even clinicians out there. Are my medicines winding up where they should be? Are they being used the way they should be? Are they being taken on a daily basis? Or are they disappearing in places they shouldn't be disappearing?
Exactly. We can have technology help allay a lot of these fears and help solve this because we have patients who are not getting the medicines they need. I have clinicians who say, I won't even treat this. So that's a significant number of our patients who could be receiving expert help who aren't, just because of the risk of diversion and the unintentional, I would say the misuse potentially of others. Am I correct? I'm not allowing people who really need it that access.
Agreed 100%, Jerry. And this is a place where I think having ADHD can actually potentially be a benefit. Okay. People with ADHD tend to like technology. They tend to be technology savants. They tend to be very technology literate. So we live in a digital world which stretches the brain. You got to be able to concentrate and focus. But we live in a digital world where interventions can help to be part of the solution. And I think ADHD people are very amenable to using digital technologies and digital solutions to help improve outcomes.